Hello. On behalf of the Patient Safety Authority, I'd like to welcome you to this web conference titled Patient-Family Engagement, an Active Strategy for a Safer Healthcare System webinar. My name is Kathy Reynolds, and I'll be your moderator for this program. Now I'd like to introduce our speakers for the webinar. Libby Hoy serves as the founder and CEO of Patient-Family Centered Care Partners. As a mother of 3 sons living with mitochondrial disease, Libby has 20 years of experience navigating the healthcare system. Libby began volunteering as a parent mentor in 1995 and has been working to improve health systems and empower patients and families to be active partners in care ever since. In her role as the first family advocate at Miller Children's Hospital, she developed the Parent Advisory Board and created the structure for the long-term integration of the patient and family voice within the organization. Libby has presented at multiple national and international conferences on subjects related to patient and family-centered care practice. As a consultant, Libby strives to share the evidence, practices, and methods that support PFCC culture in healthcare organizations. In 2010, Libby founded PFCCpartners to create a community of patients, families, providers, and healthcare organizations committed to the shared learning of patient and family-centered care practice. PFCCpartners also established the PFA network, inclusive of more than 450 patient-family advisors working in healthcare settings across the country to partner for improvement in the quality, safety, and experience and delivery of healthcare. Libby has served as advisor to Patient-Centered Outcomes Research Institute, Partnership for Patients, Institute of Medicine, National Quality Forum, and as faculty for the Institute for Healthcare Improvement. In these and all efforts, Libby strives to build the infrastructure and capacity for healthcare organizations to engage all patients and families from bedside to the boardroom. Libby lives and works in Long Beach, California. Megan Shetterly will join Libby in co-presenting today's webinar. Megan is a senior patient safety liaison with the Pennsylvania Patient Safety Authority. Megan has worked for the authority in the capacity of a patient safety liaison since August 2008. Since this time, she has worked with various Pennsylvania healthcare facilities in an effort to reduce medical errors. She has given multiple educational presentations and written advisory articles on various patient safety-related topics. She has facilitated collaboration efforts with healthcare facilities in order to improve patient safety with projects focused on blood specimen labeling and preoperative screening. She is a certified professional in patient safety, certified in Just Culture training, and a Team Steps Master Trainer. Libby, I'll now turn the program over to you.
Thank you so much. It's such a pleasure to be here with all of you today. And thank you for that very kind introduction. So, as mentioned, I'm the founder of PFCCpartners here in Long Beach, California, and we have a small vision to reinvent the healthcare industry. We really feel strongly that partnering with patients and families in the design and co-design of our healthcare system really results in a healthcare system that's robust and meets the needs of all stakeholders. So in my introduction, you heard a bit about my background, but these are really my credentials. As a teenager, I became a primary caregiver for my mother while she battled cancer for 4 years. A few years after that, I had my 3 sons who live with mitochondrial disease, which is a cellular level disease that affects the body's ability to transfer food to energy. Between them, they've had they've had 33 surgeries in 12 different hospitals in the country. Thousands of hours of physical therapy, occupational therapy, you name it, we've done it. We're that high-end user of the healthcare system. And then in 2016, I had my own battle with stage 3 salivary gland cancer and experienced surgery and concurrent chemo and radiation. So you can see that I spent a lot of time in your healthcare facilities. And as such, I've made some observations about what works really well and helps patients and families to be empowered in the system, and where there's some opportunities for us to improve together. So you can imagine, as our journey has moved forward, there have been definite moments of confusion and chaos, much like this slide. When my second son, Nicholas, was born, he was wonderful for about 2 minutes, and then he stopped breathing, and they whisked him out of the room, and 45 agonizing minutes later, Dr. Modan Liu came back in the room and with my husband behind him crying, which is something I had never seen before, and said, "I'm sorry, Mrs. Hoy, we don't expect him to make it through the night." You can imagine in those following minutes that I felt every one of these emotions, that I felt guilt. I was certain it was the Diet Coke I drank during my pregnancy. Loss and confusion, being overwhelmed, feeling helpless that I couldn't do much for my child. We were really fortunate to get great care, and in the ensuing months and years, we're able to set up a team approach to all of the boys' care. And so I can imagine that you've seen folks in that chaotic state. And so how do we ask our healthcare professionals to engage with patients and families when they're in that chaos? Well, part of the answer is to build the culture to where we can move those patients, much like I was moved, into this realm of being calm, confident, and comfortable. Calm enough to receive information, to bring my shoulders down and really feel like I had a place in the environment. Comfortable that I was being listened to, that I was part of the team, that there was physical and figurative space for me as a family caregiver in that relationship and later as a patient myself. And confident that the people around me, all of you who work so hard to deliver high quality, safe care, were going to do that for me in a way that met my needs, my priorities, and my goals as well. So what we're talking about then is really this culture of partnership that creates a safer environment across the healthcare spectrum. So I think it's important to kind of level set. There's an awful lot of terms floating around in the environment these days. Patient experience, patient-family engagement, patient-family-centered care, person-family-centered care. And we at PFCC Partners are pretty simple folks. So we've kind of created this foundation for ourselves, and I'll share it with you today, not in the expectation that this is the end-all, be-all definitions of these terms, but in a way that this is the way that I'm looking at these terms. And so for our presentation together today, I think it's important for you to know how I'm approaching these. So we sort of look at patient or person family-centered care as the model, as the noun, if you will, that culture of partnership in our healthcare settings. We look at patient-family engagement then as the verb. How do we get there? That action piece. It's an active strategy. So it's the partnership in action as we're co-designing a new, whatever it might be, a new outpatient surgery flow, or we're co-designing an infection reduction program, whatever that might be. It's that action of partnering and that active strategy. So if we think about patient-family engagement as an active strategy or a verb, then we can apply it to any outcome, to any improvement measures. And even beyond improvement programs, we can move them into program design, facility design, certainly improvement, and critically in safety improvement care. So I wanted to share today something that I was really proud to be a part of. The National Academy of Medicine, or formerly known as the IOM, might be more familiar still, gathered together a large group of stakeholders, representative of clinical staff, administrative staff, policies, payers, and patients and families. So I got to work with some really amazing people on developing this guiding framework for person-family engaged care. I know these slides are tough to read. They come straight from the National Academy of Medicine, and but the entire, all of the information I'm sharing today is available at the National Academy of Medicine's website, and I'm sure we'll get that link out to you as well. But I just wanted to kind of go over some of the features of the guiding framework and how you might be able to use it at your organizations to improve the safety of care. The framework is really a construct to create that culture I was speaking about, that culture of partnership. It includes engagement as an active strategy across the healthcare continuum. So from what we call the bedside to the boardroom, engaging patients and families in their own point of care, really does help to improve the safety net for healthcare. So when we address the culture of partnership, what that could look like is when I checked every bag of chemotherapy that was hung and every bag of everything that was hung while I was getting my infusions, I was met with nursing staff who embraced that as another layer of safety. And they really saw it as a partner. They saw me, rather, as a partner in safety. And I think that's a big culture shift. I can recall being at my son's bedside early, or in the late 90s and early 2000s, where I would look at every bag that was hung for them, and I was met with frustration and resentment from a nursing staff who felt that that was their territory and not, and were sort of insulted by my questioning. So that's a difference in culture, right? And so this guiding framework is an opportunity to really think about the elements that create culture and to take a look at how your organization can embed this culture utilizing this framework. One thing I want to mention about the framework, which I thought was really relevant in all of the organizations that we work with to implement patient-family engagement as a strategy, we often, every organization, you know, the old saying, if you've been in one hospital or healthcare center, you've been in one. And it's so true. Everyone is so unique. And what I like about this framework is that it provides that flexibility to your organization to take a look and see where are you doing well, what components do you have in place, and what components maybe do you need to work a little bit at. So this guiding framework, as you're looking at it, it doesn't require you to move from left to right. Rather, you can, you know, if you've got great leadership support, then you might just move right into some of the strategic inputs and take a look at your staff training around patient-family engagement. Or maybe you want to look at some of your activities regarding pulling in patients and families as advisors to your program. So it allows you that flexibility. Again, you can see how important it is to look at these, you know, high-level components, if you will. But what I also really appreciated about this, if you look at the gray outer circles, it's about collecting data and learning as we go, continuous learning, continuous improvement. And I think that's really important. And this is a newer area for patient-family engagement. You know, we're really still at the front end of understanding the impact of engaging patients and families. I think we know a little bit more about what that looks like and the kind of value that brings within the healthcare encounter when it comes to that other end of the spectrum where we're looking at patients and families as advisors. We're still learning a lot about what that real value is. So I like the fact that this guiding framework included that data collection. So what does data collection look like on this? Well, we work with all of the QIOs across the country, and we recently talked with them about how are they capturing their activities. This is a whole new area for them. And what we found is a good starting place is just documenting the activities. What are your patients and families, where are they engaged? Do you have bedside rounding, or do you prepare your patients before they come to a clinic visit for that interaction? What kinds of activities are going on? Just simply capturing that is a great starting point. If you've got advisory programs, what are they involved in? What quality teams are they working on, or improvement teams are they working on? And capturing that activity, I think that's a really nice place to start. And then you can move into more robust evaluations of those encounters. So, you know, particularly at the advisory level, we really encourage organizations to continually evaluate that, both from the advisor's perspective and the organizational perspective. So asking your improvement teammates, how was that engagement with that advisor? Did you find value? Did they add unexpected perspective? You know, sort of all of those pieces. And then asking the advisor, did you feel you contributed? Would you participate in something like that again? I think these are the sort of foundational elements of understanding your efforts around patient-family engagement. And I think as you collect those, The other benefit is you start to build the case within your own organization. So if your senior leaders are sort of thinking this is a great idea but not totally sure about it, you can give them specific encounters, specific information about how your engagement strategies are improving your organization. All right, and then again, more detailed implementation. So in particular, those yellow boxes in terms of what's needed in the organization, particularly the skills and awareness building. I think that's really important. So any of you who are starting out with advisory programs in your organizations, I can't tell you enough how important it is to have some consistent messaging about what the vision for that engagement is. What are you hoping to get out of it? Why is it the right time in your organization to move forward with it now? I think that consistent messaging and ensuring that your entire organization staff know about your advisory efforts. People across the organization are likely to be impacted by your advisory efforts, and nobody wants to be surprised. So I think it's a really important first step to create some consistent messaging around your advisory efforts and the value that the organization seeks. Connections, and I really encourage you as you're thinking about developing both advisory programs and any engagement practices within the clinical encounter, to go to your communities, to talk with your communities, look at your community health needs assessment, and see what kind of partners are out there that maybe you haven't tapped into before. It's also a very nice way to approach your recruitment if you're planning advisory programs, but certainly a person and family-centered approach relies on following the patient and the family through the continuum of care, and that includes your community. So encourage you to look at that as well. I think, so we are implementing this framework here in LA County with our Department of Health Services right now. And this portion of the framework in particular is providing a really nice assessment tool. So take these elements and take a look at your organization to try to get, sort of ascertain where are you strong and where do you maybe need to beef up those efforts. This can be a very nice framework for assessing your current state. Probably my favorite part of the National Academy of Medicine's work on the guiding framework was that they also authored a discussion paper, Harnessing the Evidence. And this paper, although a bit long, is well worth your read. But also what's really nice about it is in the back of the paper is a really nicely annotated list of current evidence as of 2016. Certainly we need more evidence, and that was another outcome of that group, was really identifying where are some of the gaps, what do we need to learn about patient-family engagement. But this is a very thorough compilation of current research as of 2016, of current evidence. And what's particularly useful and easy to use as someone who is not a researcher or a scientist or even a healthcare professional, what I really appreciated about it is that it's annotated directly into the components that you saw in the previous slides. So, for instance, if you identified in your organization that you need to work on some skills development, you've got a number of evidence-based papers and tools that right at your hand that can fill that need. So it's a very, very rich resource as you move through your engagement practices. And that can be, really at any stage, whether you've, you're high performers in patient-family engagement, or you're just getting started out, or you're somewhere in the middle, or with with a lot of our organizations that they started out with a bang and kind of petered out a bit. And so I think that's this body of work from the National Academy of Medicine can really support you to drive that forward, both with the evidence base and then with the practical input. And I failed to mention, but you may have noticed as the final outputs of the guiding framework, you'll notice that those line up with the triple aim for healthcare improvement. With this slide, again, as we think about patient-family engagement, it becomes that active strategy. And as an umbrella approach to improving the quality of our care, improving the safety of our care, program design, it really can be applied across your organization. So in terms of the safety of care, I recall a time when we were working on the hand-washing initiative in our children's hospital, and it had been rolled out. We had audits. We did the whole 9 yards. I'm sure many of you are familiar with that effort. But what we failed to do was really address the other half of the human beings in the hospital by not addressing the patients and the families. And so as advisors, we were able to co-design a information program where we really changed the culture in our community about hand washing in the healthcare environment, but really more broadly even. And so it got picked up in the school systems and became sort of a groundswell across our community. And that's really the potential when we're engaging patients and families. We're really targeting improvement for all of the stakeholders who are encountering that. In terms of engaging patients and families, I think this is a question I get most often. Do we start with engaging patients and families in the clinical relationship, or do we start with engaging them in organizational improvement through the role of advisor? And the answer really is in your strategic plan. So looking at your organizations, whether you're a hospital or an outpatient center or a nursing home or what have you, every organization has some strategic goals. Those might be, lined up or given to you by CMS through the HIN work or through TCPI or what licensure that you're trying to attain. Whatever those goals might be, that's where the answer is in terms of where you start. Because you want to get started with an area that the organization has already bought into. It's already, decided that this is an important, bold goal to reduce hospital-acquired infections, right? So that's a bold goal. Then the advisory role might be secondary to working in engagement in the clinical relationship, such that patients and families are, again, partners in reducing risk for infection. So the important thing here is that, as you can see the seesaw, these two things, one, you can't have one without the other. It's not sustainable, and that's the important part. So if you're working on engagement, to have engagement at the engagement practices at the bedside that aren't influenced and co-designed with advisors has a huge opportunity of missing and not being relevant to your patient population. Similarly, if you have a great advisory panel, but they're not working on anything that supports improving infection rates, then there's really, that's not sustainable either. So at some point, they both need to be addressed and supported. One without the other just isn't sustainable. So here's your Jeopardy question. What's the most underutilized resource in the healthcare environment for improvement? All right, you guessed it. Patient-family advisors. So that's a picture from the 2015, actually, Patient-Family Advisor Summit. Those are all patients and families from different organizations who partner with their healthcare partners and organizations to improve the care for all. And I think what's really interesting about this is this was a session that we hosted. We weren't able to support people getting there, but we had over 50 advisors from across the country attend this session because they really wanted to learn how to be a better advisor, a more effective advisor. And I think that that's the part that's so exciting about this work is your patients and families, your population, as overburdened as they might be, as taxed as they might be, working or otherwise, you have within your patient population highly motivated, intrinsically motivated folks to partner with you to improve care. There's no one more invested than us in your organization providing high quality care. And so I think that's really important. Earlier we mentioned the Patient Family Advisor Network. We're now up to over 600 advisors from across the country. There's this amazing resource at your fingertips, and opening the lines, creating some infrastructure for patient-family engagement. You will be so amazed at the amount of energy you get back. So I want to ask Megan to pull up a polling question.
Yeah, thanks, Libby. So you've given us so much really good information. We'd like to know from the audience a question. The first question is, does your organization currently engage patients and families in partners in improvement? But while we're waiting, so Libby, I just kind of wanted to chat with you and ask you a question. When you talk about engaged patients, and I kind of go back to one of your slides, you talked about that being an action item or a verb. So engagement, is that integration? Is that alignment? Is that both? I mean, what does that look like?
Great question. Yeah, so we refer to it as a verb because it's that interaction, really, between the patient or the family member and the healthcare professional, be that in the clinical encounter or at the organizational level for improvement. So it's that spark, if you will, in that interaction, that additional perspective that hasn't been necessarily informing healthcare improvement that now brings a unique perspective to the conversation. And I think that's really important to acknowledge. I have a silly slide that I didn't include here, but it's really about engagement does not equal entitlement. So it's not about deferring to patients and families to know best about how to run your clinic. That's not it at all. It's really the value of the perspective of the patient sitting in your waiting rooms and moving through your flow to illuminate the differences and the opportunities you might have for improvement. So it's that action-oriented kind of spark of interaction.
So again, does your organization currently engage patients and families in partners in improvement? And there was a 58% response saying yes and 40% response saying no. So it does appear that there might be some opportunities for that 40% to engage patients and families and partners in the improvement for PFE. And I would just ask you another question, Libby. In terms of culture, and you've talked about this previously, what role does that play as well?
I think culture is everything when it comes to creating a person and family-centered care model. It's really the culture that couches the relationship, right? So if we just talked about engagement being a verb, being that spark of interaction between the healthcare provider and the patient and family. And if that's the case, then that interaction, that action occurs in sort of the nest, if you will, of culture. And if the culture supports engaging and supports a partnership approach, like in the example I gave around checking medications that are getting pushed in IVs, if the cultural norm is to expect patients and families to be part of the safety of the organization, then it's supported, it's grown, it's flourished, it's empowered, that spark, right? If the culture is still, looking for our healthcare providers to have all the answers in isolation and not consider patient-family priorities and needs, then it becomes, it falls apart. So the culture is the basis for the sustainability of engagement. Does that make sense?
Yes, and thank you for sharing that. And I believe that's an integral part of that framework as well, if I recall correctly.
Definitely. So it's interesting to me, your poll results, because they line up fairly well with the national average. We know about from the, the national average in hospitals. We know from the Hospital Innovation Improvement Network that about 54% of our hospitals nationally are engaging patients and families as partners in improvement. I'm not aware of the numbers in the outpatient setting, and I know other settings have varying requirements for resident councils and such. So I think, it's safe to say that we've got folks at all ends of the spectrum when it comes to patient-family engagement. Some are just tiptoeing in, and others are really increasing their capacity, their advisory capacity. And I think that's great. Start where you are, but start. And that's, I think, the message is come on in, the water's fine, and your patients and your families will be there with you and for you. And we've done this work in South Central LA County with the safety net population, and there are folks out there, if we go and meet them where they are, that can partner with us. And so be encouraged and be brave moving forward. And I also want to say, don't feel like you have to have a counsel. It's not the end-all and be-all, the only way that you can engage your patients and families in improvement. Here's a broader perspective of patient-family engagement that you might think about. So patient satisfaction surveys, those are a piece of information. It's not all of the information, but it's a starting point. And you can look at some of your challenges in those areas. And then what I would suggest is take those challenges that have been identified through those surveys and see where they land and line up on the framework, and see maybe where you could initiate some partnership and co-design solutions. Focus groups are a great first step. If you haven't really gotten started with patient-family engagement and advisory programs, that's okay. Try a focus group around a really specific topic. Again, if you've identified areas of low scores, then take one of those areas, again, whether that's a safety metric or a patient experience metric, whatever is a high priority item in your organization, and create a focus group around it. Bring in some patients and families. There's lots of great information and resource on the web for how to run effective focus groups. Educate yourself a little bit and then dive in. This is also a really nice way if your leadership is not quite certain about the engaging advisors. We had one organization that had lukewarm support from their senior leadership, and so the PFE lead ran a focus group. And so she brought in about 6 or 7 patients and families and asked, set up a great focus group and invited the CEO to sit in. That CEO was astounded at how much information and insight that he got from that focus group, and realized that there was no other way to get that kind of information except to talk with your patients and families. And so that really made him into a convert to support those programs. So that can be a really nice starting point if that's needed. Patient-family advisory councils or programs. We have lots of organizations that implement advisory programs in terms of embedding 2 to 3 patient-family advisors directly onto quality improvement teams or safety improvement teams. And so that's when you're getting more of a continuous feedback, right? That's when it's getting a little more hardwired into your organization that you continually seek out the patient-family perspective as you're seeking to improve. And then again, the project improvement, getting folks straight onto lean. I'll never forget my first lean experience as an advisor. I was asked to join 1 week rapid process improvement cycle to address the wait times in my son's GI clinic. And so I walked in, and the physician was also there, and he said, "Well, hi, Libby, what are you doing here?" And I said, honestly, I'm not really sure. And that's a key learning as well, that you don't always know. And in fact, if you're really doing engagement authentically and robustly, you shouldn't know the outcome going in because you're co-designing it together during that process. So we carried on, and if any of you have been involved in those, everybody's nice and friendly on Monday, and by Wednesday, things are getting a little cantankerous. And so on Wednesday, the physician said, I get so frustrated with my patients' parents. They don't care about their kids. They don't call back when I tell them to. They don't follow up. And of course, took offense to that and said, well, hang on a second. I feel like you guys don't care very often because I don't get a call back when I'm asking for labs. I leave messages and nobody ever tells me, sort of what's going on. And we also had the administrator of the clinic there. And through this conversation, all right, maybe be a little bit of a heated conversation, what we identified is that patients' families' phone calls coming in were being routed to the message box of staff members who were no longer with the organization. So they were sitting in dead space and nobody was retrieving them. So you can see how easy it is for us to make assumptions about one another's motives, and yet by opening space to have these integrated conversations, we identify lots of times it's a technology issue or there's a simple solution that we hadn't thought of because we hadn't had that integrated conversation yet. So you can imagine that would not have been uncovered if one of the three of us were not represented in that conversation. So in terms of implementation, here's something you could think about. Here's those focus groups as a starting point. It's around a singular focus, but think of it a little bit as a bit of a PDSA cycle, right? Small test of change. See how that goes. What do you learn? How did you get to your patient population and engage them in that opportunity? And then moving that outward to, could be rapid improvement teams, could be more broad-based advisory councils. And I think this slide really depicts what I'm talking about when I'm saying it's an active strategy, it's the verb of how we build the patient-family-centered culture. Here's an example. So if your organization has a strategic goal of reducing readmissions, which I know many of you do, then your project or your initiative might be to implement a community coalition of stakeholders to design a transition program, really look at that transition from health setting to home or community setting. So your advisors would come in to that project. So the organization has said, this is our strategic goal, this is how we're looking to approach it, and here's these new partners, these advisors, who are going to inform the work from the patient perspective, pointing out their challenges, right? That oftentimes we get discharged from a hospital with a follow-up to our primary care or a specialist, and the home care equipment never shows up, and so who do we call? Those are the pieces of information that add to our approach and add to the value and relevancy of the project initiative and really co-designing those solutions. So this is one of our programs, the Gateways to Engagement Learning Collaborative, and that's just to say, in whatever approach you take for implementing patient-family engagement, be really intentional about it. Create a process for yourself. Create the awareness within your organization with that consistent messaging. Get out into the community to engage your patients and families. Orientation is a key piece, and I'll talk about that a little bit more because I just think it's so important and such a huge, oftentimes missed opportunity. But plan really intentionally about that launch meeting and the need for advisors and your organization to come together as a team. So that first meeting, we like to really build in a lot of team building exercises and plan for the future. Plan for this to be a hardwired strategy, just like Lean is, or just like any other process improvement strategy is embedded in your organization. So I mentioned preparation, and this is a place we spend a lot of our time. I just had a wonderful training with a group of advisors here in California on Monday, and it became clear to me again the value and importance of really distinguishing the role of advisor from the patient role. We really encourage patients and families who are moving into the advisor role to understand sort of the core competencies of effective partners and the ability to establish partnerships, the ability to be constructively collaborative, to be solution-focused. My biggest responsibility as an advisor is to be representative. That doesn't mean I can accurately represent the needs of a second language learner in my hospital. It means that I know that and I make space for those communities and those disparate populations to have voice in the system. And then at the top, we really encourage a teachable spirit. There's a heck of a lot I don't know about running a healthcare clinic, but there's maybe something that my clinics don't know about being a patient there. And when we come together with an open mind and focus towards co-creating solutions, we really can move the dial. So I think it's important for the advisor in our experience to understand your organization, sharing an organizational chart. Particularly if you're a large community practice and you've got several sites, it's not always apparent to us as a patient that there are multiple sites or there is this organizational structure who looks over all of the sites. So really sharing that information, the more context I have as an advisor, the more value I can bring because I'm going to be focused in on what's important to the organization. And then preparation to the improvement team. What are the goals? How does it work? Do you meet monthly? Do you meet weekly? Is it a time limited 6 months or is it a year project? How does that look? And then finally, and I think most importantly, to the advisor role. What is it to be an advisor? There's lots of good information out there, and I'd certainly be happy to be a resource, but we really need to say to folks, this is your patient experience. Your patient experience will inform your work as an advisor. But you're an experience of one, and recognizing that allows us to connect our experiences in the context of the improvement in front of us. So that's a really important piece. With a shared vision being the North Star of this, integration or interaction, we also want to prepare our staff members. What's the purpose? Why are we bringing these guys in? Lots of times there's misconceptions about, if we bring patients and families in, they're just going to complain, tell us all the things that are wrong. And I love when, my favorite thing is sitting in a room and watching that light bulb go on for staff members when the patients and families are showering them with praises and gratitude and offering resource and partnership to improve even more so. Setting some expectations of how that interaction is going to go, that you are preparing advisors, that you are letting them know how your organization works, and that the expectation is then that the advisors will come in prepared and ready to partner. And then I think it's really valuable to give space to our staff members to voice their concerns about engaging patients and families at the organizational level. Those are real concerns, and they deserve to be heard. My personal favorite approach to addressing a lot of them is to say, can we try it for 3 months? Can we have a small test of change again? Can we try a focus group and see what we learn? So again, it's okay to start small and grow from there. It will naturally grow because your staff will, get something from these interactions very quickly, and very quickly what we see is staff typically want more of it. Again, as long as it's organized, it's an intentional process, I think it could be extraordinarily powerful. So with that, I will go to our second polling question. And I know that you just, Megan shared with me that you just recently had a wonderful in-person PFE event, and I think there's lots of opportunity to build on some of the resources that were shared there. Is that right, Megan?
Yes. In fact, we just had a PFE conference June 4th, and we had a wonderful turnout. So I'm not sure if some of the people that are on this webinar today had attended that. There may be some that did get those resources, and there may be some that did not. So what we are going to do is provide a link in the chat box to some of the action plans that we provided at that conference. We are also going to send it out in an email to all the registrants after the webinar is done today. That it really canvasses what we're calling the 5 metrics. CMS is endorsing 5 metrics for person and family engagement. And it's everything from having a pre-admission checklist to bedside shift reporting, to having someone who is the lead person for PFE in an organization, to kind of foster the navigation of that program. It's also having PFACs, as you were saying, so Patient and Family Advisory Councils, as well as having somebody on the board who really represents the patient perspective. And so they kind of refer to those as what they call the 5 metrics. And there's a roadmap and strategies and multiple links to resources embedded in those action plans, from everything from the American Hospital Association to the the Agency for Healthcare Research and Quality, the American Institute of Research, Plaintree, National Academy of Medicine, Partnership for Patients, Institute for Patient and Family Centered Care. And it really is very well outlined and structured so that you can find things very easily. And it goes into sample pre-admission checklists, communication strategies for that bedside shift report, toolkits for eliminating healthcare disparities, patient and family-centered care self-assessment. You were just talking about what happens in an organization when you're introducing patient and family-centered care, and how the staff respond to that, or how they get educated on that, and how they relate to patients and families. So there's actually an inventory or an assessment that you can take before launching into a program or an initiative. Patient and Family Advisory Council orientation manuals, up to and including like HIPAA documents that you can use for those types of things, as well as other checklists. And a blueprint for Board of Trustees for success in PFE, and just many, many more. I mean, those are just kind of samplings. So, but what we would like to know, what are your needs? What are you looking for? Because the question is, what support would be most beneficial or helpful to you in your organization to implement PFE, or really to advance PFE? Because a number of you have already said that you feel like you have integrated patient and family engagement into your organization, but at least there were 40% of you that felt like there were opportunities. So whether you've implemented something already, there's opportunities maybe to advance, or if you've not implemented anything at all, what are you looking for? So the selections were basically PFE toolkits, guides, and programs, peer learning events, online learning sessions, one-to-one coaching, PFE tools to implement PFE in the clinical encounter, and PFE tools or resources for developing advisory programs. And so the responses are in Libby, and the one that, so to say, bubbles to the top is the general PFE toolkits, guides, and programs. So I think what I was just mentioning will be very helpful to the group. I would also say that there is a link to the National Academy of Medicine document and framework that you were talking about. So that will also be a link that is provided. And I also wanted to mention, you're right, it is very comprehensive, it is very thorough, and there's a lot of information in there in terms of evidence base, because everybody's looking for that. And there's a lot of links to those resources. But Plaintree, if people want to just Google that, also has that framework and a high-level summary and a one-pager. If somebody needs to kind of, print that off and take that to leadership just to give them a high-level overview, that is available also. The second most frequent response here is C, looks like online learning sessions at 48%, followed by peer learning events at 29%. Followed by PFE tools to implement PFE in the clinical encounter, 39%, and then peer learning events, 29%. So there's a lot of diversity in what people are needing, kind of across the board here. So we're definitely going to try to provide you with the information and the resources that you need to move your program forward.
That's fantastic. It's so helpful to understand where people are needing resource. And, boy, it was a desert 5 years ago and 5 to 7 years ago, and now there are so many rich resources. And I would also include the CMS overall patient family engagement strategy that they introduced in December of 2016 is sort of their guiding framework as well. So as you're looking at those PFE metrics, you can sort of see how those were developed. That might be another resource, and of course we at PFCCpartners as well have several resources and tools that we'd be happy to share.
Yeah, so thanks, Libby. That was very informative, and thanks, Megan, as well. Very informative presentation. that contain really valuable information for everyone that can use in their organization. And we do have a question here. My question is how to structure the PFCC, the PFAC meetings to ensure it does not become a complaint session. So Megan or Libby, if either one of you would like to take that.
I'd be happy to. This is Libby. That's a great question and really important to be thinking about ahead of time before you get into those meetings. And that's, I think the answer is really, as I mentioned, taking an intentional process, doing a fair amount of infrastructure to your engagement efforts. And that's to say that, doing a charter is very helpful. Creating a common vision statement, creating some expectations in that charter about what will occur. That's one strategy is really, providing that infrastructure and creating the role. The second piece of that is really orienting patients and families to a role of advisor. And those core competencies are really important for patients and families to understand their value in the advisor role, which is informed by their patient role, but is not the same. So I think setting that expectation early is also really important. And then finally, the approach we endorse is creating that first meeting as a space for people to share their story. What is it that brought them into this advisory role? And what we find is that when patients and families have an opportunity to share that in the forum and then are re-anchored into the charter or infrastructure of the effort, then you can really move forward because they've been heard. When that opportunity gets skipped over, that's when we hear those stories and concerns come out over and over and over again, sort of in inopportune moments, if you will. So the answer is all in the pre-work.
And can I just interject as well? Thanks, Libby. In terms of resources and focusing on advisory programs, I'm just going to go back to the polling. It must have come in after I was giving the results, but that did score high as well. People looking for those tools and resources for developing advisory programs. And, in those links to resources that, we're providing it's actually in metric 4 if somebody's looking for it. I mean, we do have in there sample letters of invitation for applications for people to be on the advisory council, actually interview questions in order to kind of find that candidate that you're looking for, a checklist of things that you may be, interested in looking for in that advisory member. And then there's even a PowerPoint in there to educate your advisors and patient and family advisors on your council. So again, I'm just pointing you back to those resources, but some really good stuff so you don't have to reinvent the wheel.
Great. I don't have any here, but Megan, I think you had a question. I think we have time for at least one more of that. Did you want to share with one of yours?
So actually, I wanted to ask Libby this question because I think this is so important to people as well. I'm not sure that we asked this in our polling question, but how do you know when a PFAC program is successful, or how do you know when you're gaining momentum, that you're going in the right direction? What should you be looking at?
Yeah, I think, again, the answer lies in your organization locally. So how well do the activities of the advisory group line up to the strategic goals of the organization? I think that's when you know you're marching in step, right? If I hear questions like, oh, what do we put on the agenda, or what do we have them work on? That tells me that it's too far out of the lane of what's important to the organization. Whereas if you're, in that slide I showed a little bit earlier, if you're moving strategy into your improvement work, it's lining up directly to meeting your organizational goals. So I think that's a really good question to continually ask yourself. And of course, as I mentioned, evaluating constantly your efforts, that will keep you and adding value.
Sure. I have found that in response to a polling question or a survey question that we asked at our conference earlier this month, that the attendees said that they look to HCAHPS, or the Hospital Consumer Assessment of Healthcare Providers and Systems survey that goes out to patients, as a way to measure success of PFE. And I just wondered what your thoughts were on that.
Oh boy, that is a big conversation in the environment right now. So my own thoughts on that are, again, from the perspective of an advisor, I think that the PFE work can support improving scores on HCAP. I don't think that the questions that the HCAP asks necessarily gets at my engagement, my level of engagement. Do I contribute to the culture of safety? Am I invited in to work not only in child or my own clinic encounter in my safety, but I'm also involved in organizational improvement in the safety. So I don't think the HCAP scores get to engagement as an active strategy necessarily. I think we have more work to do to really understand the impact of engagement.
I want to thank you both, Libby and Megan. Looking at the time, I think I'll wrap up. Thank you again, and this concludes our webinar.